Let's just dive right in. We've all been there, right? A new health threat pops up, and suddenly our phones and TVs are just a fire hose of information, warnings, and updates. It's a lot. But how is all that communication supposed to work? Well, it turns out there's actually a global playbook for this, one designed to turn all that chaos into some real clarity. I mean, think back to the start of any big health scare. It's just overwhelming. We're all scrambling, asking the same questions, trying to figure out what's real, what's a rumor, and who we're supposed to trust. It really does feel like total chaos. And it's no wonder it feels that way. You get conflicting reports from different sources, rumors are spreading like wildfire on social media, and all of that uncertainty just cranks up the public fear. It's basically a perfect storm for confusion. But here's the thing. This chaos, it's not a surprise to the experts. The World Health Organization is fully aware that this is what happens. They say right here that those first few days are gonna be rough. So the real question is, what's the plan to deal with it?
Well, they definitely don't just sit around and hope for the best. Nope. There is a global blueprint, a very real plan, specifically designed to cut through all that noise and deliver clarity right when we need it the most. It's called Emergency Risk Communication, or ERC for short. And this isn't just some dusty old guide on a shelf. It's a full-blown framework that countries all over the world use to get ready for and manage these exact kinds of situations. And getting this plan up and running is a really hands-on process. Countries work through these 5 steps. First, they train their people. Then they map out what they're good at and where they need help. They write a customized plan, test it out with drills, and then, finally, they officially adopt it. The whole idea is to be ready before a crisis ever hits. Okay, so what's actually in this plan? How does it work on the ground? Well, the whole strategy is built on 4 core pillars, and all of them, every single one, is designed to achieve one single goal that is more important than anything else. And that goal is trust. Simple as that. Because without public trust, no advice gets followed, no guidance is heard, and the whole plan just falls apart. So every part of this ERC framework is engineered to build, maintain, or even rebuild public trust. So how do you do it? How do you build that trust in the middle of a crisis? Well, it starts with pillar number 1. Pillar 1 is all about transparency and being fast. The playbook says authorities need to announce potential risks early. And here's the crucial part. They have to be totally honest, not just about what they know, but also about what they don't know yet. It's that kind of radical honesty that stops rumors from filling the information vacuum. Okay, so you're being transparent. That's a great start. But what comes next is just as important. The second pillar is all about fighting that conflicting reports problem. It means that officials have to pick official spokespeople and make sure that every single partner, from the national level down to the local clinics, is sharing the exact same consistent message. The goal is super simple. Speak with one clear, unified voice. No confusion. But, this can't be a one-way street. Great communication isn't just about talking at people. And this part is a total game changer. The plan says that communication isn't a broadcast, it's a conversation. Pillar 3 is all about listening. That means teams are actively monitoring social media for rumors, they're working to understand what people are actually afraid of, and they're creating real channels for communities to give feedback. All right, and that brings us to the 4th and final pillar, because a great message is useless if it doesn't get to the right people. So this last pillar is all about delivery. It means using the channels that people already use and trust, whether that's a specific radio station, a Facebook group, or a neighborhood leader. It also means partnering with those respected community figures who can help carry the message in a way that people will actually listen to. So there you have it, the 4 pillars of trust. But a crisis isn't a single moment in time, right? It changes, it evolves. And this ERC plan is built to be a dynamic tool that adapts right along with it. See, every crisis has a kind of life cycle. It goes from the quiet preparation phase into that chaotic initial response, then the main crisis and control phase, and finally into recovery and evaluation. And the communication strategy has to be different for each one of those stages. And you can really see how that focus shifts. Right at the beginning, it's all about getting out timely, accurate info, managing all that uncertainty, and building that crucial foundation of trust. But way later, in the recovery phase, the goals are totally different. Now it's about reinforcing new healthy behaviors, educating people for the future, and looking back at what went right and what went wrong. And get this, the plan gets even more sophisticated. It actually breaks down how to talk to different types of audiences. I mean, you're not going to talk to an active supporter, what they call a champion, the same way you talk to someone who's actively fighting the message, a blocker. The idea is to empower your champions and use hard facts to counteract the bad information.
Okay, so we've looked at this whole detailed global playbook, but what does all this high-level strategy actually mean for you and me, for the people on the receiving end of all this information?
At the end of the day, this whole thing, emergency risk communication, is really about one word: empowerment. It's designed to be a real-time, two-way exchange of information so that every single person at risk has what they need to make smart, informed decisions to protect themselves and their families. So when this plan is actually working the way it's supposed to, it does these four amazing things. It builds public trust. It actively fights misinformation with transparency. It gives you the power to make good decisions. And maybe most importantly, it turns all that scary initial chaos into life-saving clarity. So the next time a health emergency starts making headlines, you'll actually be able to see this playbook in action. You'll know what to look for. You can ask yourself, are they being transparent about what they still don't know? Are all the agencies speaking with one voice? Are they actually listening to public concerns? Because being able to spot those signals of trust, that's your first step to navigating the storm.